Hello everyone. Today's topic is inspired by family dynamics at the end of life. This is a time when we should be united, but it is often where the greatest discord is found. Often, the discord comes from disagreement among family members, and it almost always revolves around the care of the patient. Some believe the care should be done in a specific way, while others do not want certain medications. And others might seek other alternatives where they want to implement in those final days. And most of the time, the patient is already so weak and decline that they are near death. As I shared before, there are a series of signs that indicate the body is preparing to die. I have always believed that the body knows how to die. My talk today is inspired by situations I see frequently. Although the true root cause of many of these discords is the inability to recognize and understand what is manifesting before our eyes when a loved one is in their final stages. Today, I want to share some key physical and mental signs on what to expect in the final stages of life. When discussing end of life, we use the terms preimminent and imminent. Preimminent is considered days before death, while imminent implies death that can happen at any moment. Although the process of death and dying often has begun many months before. During the preimminent state, the patient stops eating and has difficulty swallowing. The loss of appetite usually starts earlier on, but it becomes more pronounced now. The patient might not only refuse food, but also struggles with swallowing. While it might be tempting to encourage them to eat, it is important to understand that forcing food can lead to nausea, vomiting, or choking on their own fluids or the food itself. The ability to swallow is part of the natural body mechanism to protect and conserve energy for essential functions. At the same time, the mind is also going through changes. It's common to see patients be disoriented and confused, and to talk about people or things that are not present. They might seem or converse with deceased loved ones and even mention visitors that others haven't seen. In this phase, the patient also might be sleeping most of the time and have difficulty waking up. You might also notice brief periods of alertness or energy, known as rallies, where they engage in conversation with little or no confusion. This is a temporary clarity that doesn't indicate recovery, but should be used as a precious moment to enjoy time with your loved one. Now, let's discuss the imminent stage. This stage can be days to hours, and the patient might come unresponsive. Other signs of imminency are fixed gaze or glazed eyes, irregular breathing with periods of apnea, gasps, or even shallow breaths. Other symptoms are congested sounds from mucus in the throat and chest, which resembles snoring or also called a rattle. While these noises might seem distressing, it typically doesn't bother the patient. However, medications can help alleviate this congestion, so please consult your nurse for assistance. Sometimes I am asked about certain interventions at the final stages of life, like IV fluids. These are generally not recommended for patients in the final stages because their body can no longer absorb fluids, which might accumulate in the lungs and cause complications such as pneumonia. Others ask about feeding or feeding tubes. When a patient can no longer swallow and it is often unconscious, a feeding tube is not appropriate. A feeding tube is used if there is a chance of recovery and that the benefits will provide quality of life. Families sometimes struggle to accept the end, wanting to take the patient to the hospital even if the prognosis has been explained. Going to the hospital won't change the outcome. If hospice care is being provided at home and in a residential facility, it's because a terminal diagnosis has been made. The hospice philosophy is to allow patients to die in their own environment, surrounded by family and the hospice team, without aggressive interventions. This approach creates a peaceful and loving environment at the end of life. What else can we do? It is important to honor the religious and spiritual aspects for both the patient and the family. Calling their pastor, priest, or spiritual leader can offer comfort to everyone involved. Many of us don't like to plan ahead, but if I can urge you to do one thing, is to ensure that funeral arrangements are already in place. When the final moment comes, we might not be in the mental state to make the best decisions. Also, being present and united is essential, as well as showing love and support to one another, even when it's the most difficult. As mentioned before, hearing is the last sense to go. So it is important to communicate with the patient even though they might seem unconscious. Telling the patient that they are loved and that everyone will be okay is fundamental. In my experience, many patients resist leaving their loved ones. While it might be difficult, giving them permission to die provides them a peaceful passing. Finally, honoring and respecting the patient's wishes is crucial for both the patient and those who fulfill these wishes. I hope that this information is helpful if you or someone you know is experiencing or anticipating this stage. I am your dedicated nurse, always educating, supporting, and guiding you.